歡迎大家嚟到20。
Welcome to the press conference for the vaccination program for COVID-19. Let me introduce the officials on stage too. We have Mr. Patrick Nip, Secretary for the Civil Service, Dr. Constance Chen, Director of Health, and also Dr. Sophia Chen, Secretary for Health and Food. First, Mr. Nip will give some introduction remarks. Thank you. We received written information from BioNTech and Fosun that there are issues with packaging lids on batch 210102. BioNTech and Fosun Pharma have to carry out investigation because of the packaging issues. So this morning, we announced that during investigation, we will suspend the vaccination program unless pending further notice. The manufacturer stressed that it's just a preventive measure. And after investigation, there will be notification to us again. Various community vaccination centers have suspended the vaccination using BioNTech vaccines pending further notice. So those who have bookings today need not go to our vaccination centers for the jab. We issued a press release earlier on, and then before noon, myself and Professor Sophia Chen have briefly responded to concerns about this issue. And the Department of Health has immediately met with Fosun, and then after that, would also give you an update of the situation. The government has issued a text message to all who have bookings today for the BioNTech vaccine, and for the new arrangements, we will inform persons concerned later. I'll give the floor to the Director for Health to brief us on the latest situation. Good afternoon. I'd like to report to you the suspension of vaccination using BioNTech vaccines. The Department of Health has got a very stringent system for monitoring drugs, including vaccines. And if users of drugs see anything abnormal after the medication, they will report to us, and if we receive a report, we will liaise with the manufacturer, if it is a local manufacturer, and also the agents of an overseas manufacturer for follow-up. Now, for the community vaccine, we've been monitoring the situation since the start of the program. We have imported 2 batches of community. On the 28th of February, batch number 210102, we have got 585 bottles, 1,000 bottles, and then batch 210107 arrived on the 7th of March. There are 758,000 doses. Now, the unit is dose. For the first batch, we've got 585,000 doses, and for batch 210104, we've got 758,000 doses. Now, we have been giving a batch 210102 vaccines to our local community. So far, about 150,000 doses have been administered. Our frontline personnel, medical personnel, and also pharmacists are very careful with the use of drugs. We have got on 8 occasions we have saw cracks on the bottle, and when we diluted the dose with saline water, we noticed that the pressure was a bit high, leading to some leakage, and there were 25 occasions. And some occasions we found that the lids were a bit loose. and some stains were found on 14 occasions on the bottles. Well, because of that, we reported the situation to Fosun for follow-up with the manufacturer. Upon receipt of our report, the manufacturer informed us in writing that for a batch 210102, so far they do not see any issues related to the safety of the vaccines. However, they have to carry out a comprehensive investigation. So to play safe, they've asked us to suspend the use of batch 210102. And for batch 210104, it is now in our storage, and it has never been used yet. And so they will be kept for the time being and not for administration. And so we had an urgent meeting with Fosun this morning. Fosun has promised to carry out an immediate investigation. So they're going to approach the manufacturer in Germany and to look into their plant in Germany. And when the vaccines arrive in Hong Kong, they will have a review of the whole logistics chain to see whether that's the cause of the current situation. Their follow-up investigation report will be provided to the Department of Health for our scrutiny ASAP. Pending completion of the investigation, we will suspend all vaccination using BioNTech vaccines. So people affected will be those who have to receive their second dose this Saturday. They will be immediately affected. We'll urge the manufacturer to give us a report as soon as possible to see whether the batches we have in Hong Kong can be used. If not, then they have to deliver another batch to us as soon as possible. For those who have appointments this Saturday, now if we cannot resume the vaccination before that, then we will give reference to the advice given by the Joint Scientific Committee set up by the Department of Health for the vaccination. Now, the second dose should be administered 21 days after the first dose. Now, because of the special circumstances and having regard to the clinical data, for the third clinical trial, the second dose can be administered anytime between 19 to 42 days after the first dose. So we will see whether the current batches can be used. If not, we'll ask them to give us another batch ASAP. And the US and Canada have advised on such circumstances. Now, if the second dose cannot be administered now, then when the second when another batch arrives at Hong Kong, then the second dose should be administered as soon as possible. There is no need to repeat the first dose. So we'll inform people who have to get their second jab this Saturday our latest arrangement.
We'll start our Q&A now. Before you start your question, would you please introduce yourself? Perhaps I will first supplement. I would want to say the following, and that is as of last night, 8 p.m., in terms of vaccination, our numbers is as follows. At present, cumulatively, we have 403,000 people who have received the first dose, and of which 252,800 are Sinovac vaccine, 150,200 received the BioNTech vaccine. So this is the latest situation. And just now, the Secretary and Department of Health had given you some of the specifics concerning the situation and also the follow-up work after discussions with Fosun Pharma, the manufacturer of the vaccine. Now, this incident is handled according to the mechanism of the monitoring of the vaccination program. that is established under the Department of Health, and according to the request of the manufacturer, we will suspend the vaccination program for BioNTech, and this is a precautionary measure. At present, there is no reason to believe that there is any safety-related risks. So, concerning vaccination, what is most important is that it is safe, effective, and the quality lives up to the standards. Now, in terms of quality and safety, we do not see any problems as far as we are now. So we also have noticed that this morning, because it was only this morning that we received the notification from the manufacturer and we made the relevant arrangements, and therefore it is true that certain citizens have arrived at the community vaccination centers before they realize that there is no vaccination to be given today. And we understand that, and we will try our best to make the appropriate arrangements as necessary. For BioNTech vaccination, the booking will be stopped 2 days before the day. So on the internet, it would be tomorrow, the day after, and then the day after that, that would be open for booking. But we will suspend the booking, and we will wait for information as to when we can resume the vaccination program for BioNTech before we receive further bookings. Now, for those citizens who have booked the vaccination, please be informed that the vaccination will be suspended until further notice. If you have made any bookings, you do not have to go to the vaccination centers in the community to receive vaccinations until further notice. Yes, the second row, the gentleman in blue, please. Now TV, greetings. First of all, this problem with the cover of the file. What exactly is the situation? Is there any contamination, or is there any leakage? And this morning, it was there were citizens said that the Zhongshan Community Vaccination Center did open for vaccination, but it was told that the batch 210102 vaccine were not administered today, but had 210104 batch been opened and used? I mean, if it is indeed 210102 batch that had been administered today, this morning in Zhongshan Center, then it means that the vaccination was still administered after suspension. And what about those who have already received the jab? Will there be any discomfort that they will be feeling, and what should they do? Yes, I will be answering question number 2. Now, we have received the written notification from the manufacturer this morning, and we have suspended the vaccination program right away. There are 2 batches that we have imported into Hong Kong, and our colleagues have been in touch with Fosun Pharma, the manufacturer, about the situation. And after that, we have notified the vaccination centers. So in the actual process, perhaps there were some communication issues or maybe some confusion. We hope that you will understand, and we regret that. And we have already, in the first instance, made the arrangements and reaction. As mentioned just now, 210102, this batch had been used all along for vaccination in Hong Kong for BioNTech vaccination. The other batch had not been opened and used yet. And even this morning, for those who have received the vaccination for this batch, it would be the same as those who have received the vaccination of BioNTech before, and that would be from the same batch. And this is really a precautionary measure that we have suspended the program. In terms of quality and safety, we do not see any issues so far. We hope that that is clear to all. On receiving the report concerning the packaging issue, it is basically about the file cap being loose. As for the dilution with saline solution, perhaps the pressure inside the vial was big, and therefore the diluted solution leaked. And on observation of these instances, then the vial would be disposed of and will not be used. And I would want to emphasize here that during the process of vaccination, when we receive the vial of drugs, and at the vaccination center, we have professional experts, pharmacists or service provider colleagues. They will do the dilution. As you know, for each vial of BioNTech vaccine, it will have to be diluted to 5 times before they can be administered. And during that process, the colleague will be very careful in looking at the solution, and before administering the injection, the colleague would also look at the needle and the injection itself as well. If there is anything unusual noticed, then the vaccine or the needle would be disposed. And I can assure you that this process is strictly adhered to, and problematic injections are not used. As for BioNTech, usually there would be some symptoms such as headaches or light muscle pain, etc. All these are already known. And so far we do not see, and the manufacturers do not see, any safety issues. So please be assured. But of course, if anybody feels uncomfortable, they should go to the doctor for consultation. All records are kept. After the investigation of the manufacturer, if there should be anything that we should follow up on, we will have the records to do the follow-up work. I would like to supplement a couple of points. I want to reiterate that in our vaccination centers, for handling of drugs, there is a very stringent procedure, and the Department of Health, whether it is for the entire procedure guidelines or for the different vaccination centers operators, they are all very stringent in their procedures in transport of the vaccines, and also the vaccines on reaching the centers, the storage of such vaccines, the dilution of such vaccines, and also the injection of vaccines for citizens. There would be experts, professionals, doctors, nurses, and colleagues who will monitor the entire process and situation. As mentioned by the Department of Health just now, for those citizens who have received the BioNTech vaccine, the manufacturer had told us that there is no reason for them to believe, and they have discovered no reason to believe that this batch of vaccine has any safety risks. So please do be assured. And during the entire process of vaccination, it is very stringent. And as mentioned by the Secretary just now, even though we saw that certain vial caps had been loose, but these vials had been thrown away, so they have not been injected into citizens.
The lady in white. Good afternoon. I'm from Commercial Radio. I'd like to know whether Fosun has ever disclosed how long the investigation is going to take. You stressed that there is no safety risks. Well, even though there is no safety risk, will the defects on packaging affect the effectiveness of the vaccine? As a result, the vaccine may not be able to achieve its desired result, and that the injection is in vain. For those who have received the second dose, the first dose, they need the second dose very soon. What is the advice to them? If the investigation is still ongoing, after 40-odd days, what will happen to those who have received the second dose? Will that affect their protection? And then the press release was only formally announced at 10 a.m., much later than Macau. So why can't the press release be released as soon as the news was received? Would you say that it was released too late? Has the government played a sufficient role in gatekeeping? When soon as the batch arrived, did you examine them whether there is any defect? And what about community that have yet to reach us? Will that affect or delay your plan to extend the vaccination program to cover those above 16? Now, the investigation by Fosun, well, we have no idea about their timetable yet, because the director has just had a meeting with Fosun, and they will proceed with the investigation as possible because it involves the manufacturer of the vaccine in Germany. Regarding defects of the packaging, the manufacturer has made it clear that it has got nothing to do with the safety of the vaccines, but to play safe as a precautionary approach, the vaccination is suspended until investigation is complete. In fact, when it comes to the administration of the vaccine, when each file will be closely examined, as said by the director. If there is any thing observed, then the file will not be used. So this will not affect people who have received the vaccine. Regarding the administration of the second dose, according to the advice of the Joint Scientific Committee of the Department of Health, the second dose can be administered anytime between 19 and 42 days after the first dose. If that period is passed, well, when the vaccines arrived, then the second dose will be administered as soon as possible. There is no need to receive the first dose again. We'll liaise very closely with the manufacturer, hoping that the investigation can be completed as soon as possible. And then we can have a clear account of the whole matter. With regard to this morning's arrangement, because this morning we received a written notice from Fosun. In Hong Kong, we've got 2 batches of vaccines delivered to Hong Kong from Germany. So we need to clarify with Fosun Pharma the content of the written notice and also details about the 2 batches before we can make arrangements. So in the first instance, we made the arrangements, and then the press release was issued at around 10 a.m. Given the very tight time frame we have, I think we already reacted in the fastest way. Because the notice only arrived this morning, inevitably there would be members of the public who arrived at the vaccination centers before the news was announced. I ask for the public's understanding. And as regards gatekeeping, in the whole vaccination program, we have noticed that we've been checking for defects on the products, and we have followed our mechanism to report incidents to the manufacturer. And that's why the manufacturer has activated its follow-up action. You may say that this has proved that our mechanism is effective. We have not started using the second batch. The vaccines are still in central storage under negative 70 degrees Celsius. So the product can be stored for a few months under negative 70 degrees Celsius. So 6 months from the date of manufacturing. So if we discount the delivery time, so it will be a few months. But after thawing, the vaccines can only be kept in refrigerator from 2 to 8 degrees Celsius for 5 days. So we have suspended removing vaccines out from the negative 70 degrees Celsius refrigerator for thawing. As for whether we're going to further expand our priority groups, we will monitor the vaccination program and make appropriate arrangements. We'll closely monitor the situation. Before the investigation is done, the vaccination program using community will be suspended, but vaccination with Sinovac will continue. We've got 8 community vaccination centers and 18 general outpatient clinics of hospital authority open as usual. The vaccination program is not affected at all. So those who have bookings for receiving the first dose or the second dose of Sinovac can approach these centers, and they may also approach private GPs for receiving Sinovac vaccines. Thank you. We'll take some English questions. The lady in ponytail.
Testing. RTHK English News Server English question. First, about can authorities tell us the exact time that you guys get the written notice from Fosun this morning? And why was there a delay in the announcement when Macau, who is experiencing the same problem, can make an announcement 2 hours before Hong Kong did? And would the authorities apologize to those who still got a BioNTech jab this morning despite this situation? Second question, can authorities tell us what is the exact issue when you're talking about packaging defects? And does this packaging design contain other features to prevent possible contamination? And according to your understanding, do you have like a preliminary reason that you think it's a possible cause? Is it to do with the temperature change during the thawing process or due to the logistic issues? And third question, are you concerned that this will deter people from getting a jab when public confidence over vaccination here in Hong Kong is already not quite high? Thank you.
Thank you. I'll answer your first questions, and then I will invite the director to answer the remaining questions. We received the written notification from Fosun farmers this morning. And in Hong Kong situation, we have 2 batches of BioNTech vaccines. So upon receipt of the written notification, colleagues make liaison with the Fosun farmer to confirm the, understand the situation, and then notify the vaccination centers about the suspension of BioNTech vaccines vaccination. And then we issue the press release to make the formal announcement at around 10 a.m. So we received the written notification this morning. We immediately taken the necessary follow-up action. And because the amount of vaccines and also more than 1 batch of vaccines are involved, we obviously will take time to liaise with Fosun farmer to confirm the situation and the understanding before we implement the suspension action. So as the written notification was received this morning, so there will be bound to be people make the booking this morning or today, and then arrive at the vaccination and find out that the vaccination was suspended. So we issued a written SMS notification to all who have made the booking today, and let them know about the latest arrangement. So we apologize for any inconvenience caused, but we have done all we can and to minimize the inconvenience cost. I will not, I will not talk about the details chronology, but we can tell you that we received a written notification this morning, and there is a very limited time for us to act before the centers are open for operation.
All along, we have a very robust system to monitor the vaccination program. As I mentioned earlier, Hong Kong has imported 2 batches of BioNTech vaccine. The first one, batch number 210102, of 585,000 doses received on February the 28th. And the second batch is batch number 210104, received on 7th of March, which comprises 758,000 doses. All along, we monitor the situation, and from time to time, we receive report from our front line and on any observations. So as far as this case is concerned, we have received information related to, for example, cracks in the container. There were 8 cases. There were reports on leakage due to overpressure inside the valve and leakage of normal saline upon dilution. There were 22 such reports. There were 16 reports related to the loose caps, and there were 11 reports related to stains or marks on the outside of the bottles. So we took all these referrals very seriously. And under the established mechanism, we will ask the agent in Hong Kong, that is Fusan in this case, and they will in turn inform the manufacturer, BioNTech, whose manufacturing plant is located in Germany. So upon receipt of the written notification from BioNTech this morning, they advise us that at present there's no evidence which leads to any risk related to the vaccine safety. However, as a precautionary measure, BioNTech requests us to suspend the use of batch 210102 until the investigation is complete. At the same time, the other batch, that is 210104, is currently in the warehouse and is not yet used. And as a precautionary measure, BioNTech also requests Hong Kong to put on hold the use of the second batch. So right now we have arranged an urgent meeting with Fusan this morning. And according to their risk management plan, they will conduct investigation in Hong Kong, mainly focused on the logistic chain, the transport, the handling, and the delivery to these vaccination centers to see if there's any issues. At the same time, they will also liaise with BioNTech to conduct inspections to the manufacturing plant in Germany to ascertain whether or not there's any issues there. So until the investigation is completed, we shall put on hold the vaccination service of the BioNTech vaccine.
Okay, regarding your question on vaccine confidence, I would like to say a few words. First of all, I think it is important for us to have open and also transparent information for the public so that they know the detailed information of the vaccine that they select. Secondly, that we have robust mechanism, not only on the reporting or the notification of adverse events, and also having an expert committee to look at or to find out whether there is causality regarding the adverse events to vaccination. But we also have a robust mechanism in monitoring the drugs. And this time, this is an example of our reporting of the issues that our Director of Health has just reported to the manufacturer, and then they have called for an investigation, and now for a precautionary measure that they suspend, the vaccination. So the system is in place and it is robust, and there will be continuous monitoring. And finally, I think with the existing mechanism that we have, all the vaccines that we have authorized for emergency use are safe, efficacious, and also of required quality. This time it is the packaging issue that, as requested by the manufacturer, to suspend the vaccination. As Patrick has earlier reported, the Sinovac vaccination is not affected. So Sinovac vaccination will continue in the 8 community vaccination centers, the 18 general outpatient clinics, as well as all the general practitioners who have opted for the government vaccination program.
好，呢一邊戴眼鏡嗰位男士第三行。
你好，香港嚟。
The gentleman over there, Hong Kong 01. I would like to ask, actually, before, the Department of Health had already noticed certain loose caps and leaking situation. Why was there no information given to the public, but rather you suspended because you received notification? And how many files had been defrosted, and how many files had to be thrown away as a result? You mentioned just now that that there is a mechanism for looking at the different files, and still the files were given over to the community vaccination center. Does it mean that there was mishandling during the logistics here in Hong Kong? So the other question is that for the vaccination centers for BioNTech, will they be changed to Sinovac vaccination? To answer your question, first of all, for central storage, they will look at the bookings at each of the community vaccination centers to arrange sufficient numbers of vaccines to be unfrozen, and then the vaccines will be transported to the vaccination centers. During the transport, they are in boxes, so they are not opened. Only at the vaccination center, at 2 degrees to 8 degrees Celsius temperature refrigeration, will the boxes be opened and the vaccine taken out. And then there will be professionals who will dilute the vaccines and then draw the solution from the files. And every time there will be inspection of the files. Where there are any defects found, the file will not be used. The vaccine will not be used. So these defects, did they occur before or after reaching Hong Kong? We will have to look into that. We cannot reach a conclusion that this had occurred after they have reached in Hong Kong, because when they reach Hong Kong, they were delivered in boxes and the boxes were not opened. And there were some vaccines which have been delivered to the vaccination centers and stored in 2 to 8 degrees Celsius refrigeration. And there were 11,000 doses altogether in the vaccination centers. Because we only had 1 to 2 days and we have now suspended the program, it is possible that these doses will not be able to be used. So that is in terms of arrangement.
If I may say something more about the vaccines, as we all understand it, the community vaccines have very stringent requirement in terms of storage. It has to be stored at negative 70 degrees Celsius, and there are a lot of restrictions and constraints when it comes to storage, so we will not and cannot check each and every bottle before use. So they have to be stored in -7 degrees Celsius refrigeration, and they will only be taken out for dilution. Just like the administration of other vaccines, because other vaccines for other diseases may also require dilution. So vaccines that require dilution will be checked very carefully by frontline healthcare staff or pharmacists. And if there is any problem detected, then the vaccine will be discarded and not used. So the handling is on a par with that of other vaccines. We will report the situation to the manufacturer. When we're talking about a large batch of vaccines, there are established acceptable deviation in packaging. So that's the ordinary situation. We will report this to the manufacturer, which will decide when delivery or use of the vaccines can resume after the investigation. The lady in the blue mask and the second last row. Good afternoon. I'm from Mingpao. I'd like to ask more about the timeline in terms of a government notification. When did the government know of the packaging issues you mentioned? Were they identified by vaccination centers run by the hospital authority? Can you tell us the centers involved, and what is the time gap between noticing that and informing BioNTech? And I'd like to know the time you received notification from Fosun this morning, and when you informed vaccination centers to suspend the vaccination, and why is it that in between you once asked vaccination centers to resume the vaccination? During the period, how many persons have been given the vaccination? And I'd like to know whether you can ask for a refund for the vaccines concerned. I'd like to know whether the government will do any sample checks of the vaccines for microorganisms and contaminants, and what are the results if you have. And is there any views from experts as regards the cause of the current situation? Is it because of storage and thawing, and also contraction and expansion due to temperature change? Mr. Nip, well, we have such a mechanism in using vaccines. If we notice any defects in vaccines being used, there is a mechanism for the manufacturer to be notified, as said earlier. So we have administered about 100,000 odd doses, and defects found were in double digit. So all vaccination centers, when using the vaccines, if they spot any defects in the vaccines or bottles, they will not use such products. They will notify their supervisor so that the manufacturer can be informed of the situation. And this morning, we received written notification which said that there were packaging issues and no safety risk was involved. But to play safe and as a preventive measure, we suspended the vaccination. In Hong Kong, we have 2 batches of community vaccines, so we have to confirm which batch was involved, and also the use of the batch concerned. So that took some time. If we had only 1 batch, the situation would be much simpler. So we informed the vaccination centers the soonest possible. And because some centers started operation at 8 a.m. So the vaccines were given to some members of the public, and when they were informed, they suspended vaccination. And some members of the public were not aware of the situation. They arrived at vaccination centers and found that the program was suspended. They just left. So as at 11 a.m., about 1,080 doses of BioNTech vaccines have been administered. As regards whether we can get a refund for the batch involved and also testing, I defer to the director. We will wait for the detailed investigation and report from the manufacturer before we decide how to deal with the current batch. If the batch can be used, we'll use it. If not, we will ask the manufacturer to switch, to give us another batch for use. A follow-up question. It was mentioned that at 8 a.m. vaccination started and some members of the public were given the jab. But according to information we received, some vaccination centers resumed giving the jabs after suspension. Is there any communication breakdown? Yes, there was some communication problem, but I think it's because after receiving the written notification, we were considering whether vaccination should be suspended. But because there are two batches, we have to confirm which batch is problematic. So we've got two batches. Theoretically speaking, the batch without those issues can be used. I think that's the reason. Besides, 19 vaccination centers are involved. So we will have to inform the centers one by one, some soon and some later. So maybe at the very beginning, and some centers continued with the vaccination. But this is purely a precautionary measure. As of now, we do not see any safety risks associated with the vaccines. The vaccines used this morning are just the same as what have been used in the past few days. So for members of the public who received the vaccines this morning, there is no need to worry. We will approach the manufacturer, and then when vaccination can resume and bookings can start again, when all these are confirmed, we'll give an account to the public to minimize convenience to the public as far as possible. And quality assurance or quality test. Well, we did tests on the microorganisms and they were found to be normal. Last question, the lady in the second row.
Can the government get AstraZeneca earlier than scheduled, or is it looking into procuring other brands? Second question is, what would be your recommendation to people who have already taken first dose of BioNTech, and would you recommend that they take Sinovac for their second dose? Thank you.
Okay, I'll first of all give some comment, and then the Director of Health can supplement. First of all, as far as AstraZeneca is concerned, our earlier communication with them, as we have signed advanced purchase agreement with them, the delivery date is within the second quarter. So as far as the current, our most updated information, it is still this time. So I think we'll continue to communicate with AstraZeneca as to the delivery date. As far as after taking the first dose, I think the Director of Health have earlier said in Chinese about the recommendation of the Joint Scientific Committee. Perhaps I'll invite the Director of Health to provide details.
I would like to supplement that we have not yet received the application for authorization for AstraZeneca's vaccine, and we will closely monitor the situation, including to scrutinize the most updated data to be provided by the applicant in due course. As for the dosage of BioNTech, the recommended second dose is scheduled for the 21st day, and we are aware that there is a chance that the investigation report to be conducted by BioNTech, we hope they can submit to us as soon as possible. But in the event that it cannot provide the full investigation to us in time before we start administering the second dose, we would recommend to those who have received the first dose to wait for our further announcement, because we do not recommend people to receive a second dose of a different brand. So please wait for announcement by the government. Right now you asked about using another brand. Maybe you are referring to some research ongoing by the university, but that's on a research basis. That's not for the routine administration. So please wait for the government announcement. We will issue the announcement as soon as we can.
好，咁多謝各位。
唔該晒。